Hello, everyone. My name is Gina Harris, and I do want to apologize. My voice is a little raspy. I am at the back end of COVID and am just now getting my voice back. So I will try to speak clearly as I can. Today, we will be talking about adjustment disorder, a common yet misunderstood mental health diagnosis. Adjustment disorder describes a person's difficulty in coping or adjusting to a significant life stressor. These stressors can include losing a job, ending a relationship, experiencing a major illness, or the death of someone close to you. While everyone experiences stress, not everyone develops a disorder. The key difference lies in how deeply the stress impacts daily functioning and emotional well being, as you can see in the DSM 5TR. The five main criteria define adjustment disorder. First, symptoms must develop within 3 months of the stressor. Second, the distress is out of proportion to what would be typically expected or causes significant problems in work, school, or social life. Third, the symptoms don't fit the criteria for another mental health disorder and aren't merely an extension of one. Fourth, the reaction is not normal bereavement, meaning it's not typical grief. And finally, the stressor or its effects end. Symptoms should not last longer than 6 months. And you can find that in the DSM 5TR. Clinically, this disorder bridges the gaps between normal stress reactions and more severe psychiatric conditions. It can involve a range of behavioral symptoms such as anxiety, sadness, hopelessness, irritability, or reckless behavior. Physical symptoms like fatigue, insomnia, or muscle tension sometimes occur as well. The DSM 5TR identifies several subtypes of adjustment disorder, including those with depressed mood, anxiety, mixed anxiety, and depressed mood, and disturbances of conduct. This flexibility allows clinicians to tailor the diagnosis to the person's predominant symptoms. Adjustment disorder is surprisingly common. Research suggests a prevalence of 5 to 20% in outpatient settings and up to 50% among hospitalized patients. And you can find that information in the DSM 5. Unfortunately, it has gained a reputation as a default diagnosis. So when clinicians can't clearly identify another disorder, however, this misunderstanding likely stems from limited assessment or lack of diagnostic clarity, rather than the flaws in the diagnosis itself. When properly applied, adjustment disorder captures a meaningful, time-limited struggle with stress rather than pathologizing normal life changes. Treatment for adjustment disorder often involves psychotherapy, medication, or both. Cognitive behavioral therapy, CBT, is one of the most effective methods because it helps individuals recognize negative thinking patterns, improve problem solving skills, and develop healthier coping strategies. And you can find that in Abnormal Psychology by Hooley. The prognosis for adjustment disorder is generally positive. Most people recover once the stressor resolves and they have adequate support. What makes this diagnosis unique is that it emphasizes the importance of context, how life events, environment, and individual resilience all interact. In other words, adjustment disorder reminds us that mental health exists on a continuum shaped by both external stress and internal coping capacity. In summary, adjustment disorder is not simply a mild condition or a catch all diagnosis. It is clinically valid and situational reaction that highlights the human need for adaptability in the face of life's inevitable challenges. Thank you guys for listening.